growing up, it didn't really affect my life. I mean, it was just part of my life. I had always had heart disease. I didn't know any different. So hypertrophic cardiomyopathy and cardiovascular diseases have been in my family for generations. In my immediate family, I've lost my father, my oldest brother, and my mother to these diseases.
So hypertrophic cardiomyopathy is the most common inherited, which is to say genetic, cardiovascular condition. It's essentially a problem where the individual muscle fibers of the heart are too thick. And because they're too thick, the heart can't squeeze correctly.
In my early 30s is when I think that I changed from asymptomatic to symptomatic.
Turns out, regardless of why you have heart failure, the symptoms often wind up really being pretty similar. Shortness of breath, difficulty doing your day-to-day activities, trouble with swelling, and things of that nature.
In my mid-30s, my husband and I were out with neighbors. I was walking with another neighbor to catch up with that group when all of a sudden I fainted. And I did come to, fortunately, but that incident led me to have an EP study. That's when I met Sue Deanna years and years ago. She was told not to let me go until I agreed to have an implanted cardio defibrillator. Having an ICD is really life-saving. You never know when it's going to fire, but thank God that it does. It did fire twice for me and likely saved my life. One day, I had an appointment for an oxygen saturation test. I failed it miserably. We sat down and he said that in order for me to survive, I would need a heart transplant. I was not blessed with good genes, but I was blessed with AB positive blood. And that means that I am the universal recipient. And because of this blood type, 5 weeks later, I got the call from Tufts saying that they had the perfect match.
Dartmouth is what's called a shared care center. What that means largely is patients that come to Dartmouth that may need to be considered for something like a cardiac transplantation ultimately wind up getting evaluated down in Boston at Tufts Medical Center. We have a long-standing, decades-long relationship with them where the different doctors all work together, the nurses all work together, and we work together to sort of make sure every aspect of the treatment is covered for the patient.
Brian came to pick me up. We stopped at home to get my bag and told my boys, and we went to Tufts. I arrived. I remember someone asking if he could pray for me, which, yes, please do. And then they told me that the heart that they went to get was viable. And the next thing I remember, I was waking up in my room, my recovery room.
Kelly has had an amazing post-transplant course. She's had some complications that are pretty typical for patients who are on chronic immunosuppression, but she has stayed incredibly active, incredibly healthy.
After my transplant, I went back to work. My husband and I started to travel. We went back to skiing. We did outdoor activities. I could breathe again. I could celebrate holidays with my family. I could celebrate birthdays. She's a good girl.
Yeah.
Having a heart transplant is not for the faint of heart. There are a lot of things that you have to do to honor that gift and to keep that gift alive.
What makes Kelly an incredibly special person, not just a special patient, is that she has paid her success forward. She does everything that we've asked her to do in terms of advocacy for the American Heart Association, for Go Red for Women, in addition to having children and a full-time job and a husband. So that's what makes Kelly really special.
I was in denial for so long, and I ignored it for so long.
Our team is an advanced heart failure team, so we see primarily patients with heart failure, but we completely understand that the patients that we are seeing is just the tip of the iceberg in terms of the number of patients out in the community, and we certainly need to rely on our community partners and colleagues to help us manage this population, which continues to grow.
You need to seek that help. Your doctors are your friends, or can be your friends. Tell them every symptom that you have so that they can treat you properly. I wouldn't be here without my donor. So I would encourage everyone who is not a registered donor to go to registerme.org and sign up. Organ donation saves lives. It improves lives. It's the ultimate gift.